So I want to start by saying welcome to all of our guests and allies, and of course, members of the media for this press conference, which is on the theme that you all see, expanding services, state services provided by 1199 state healthcare workers to save lives. I am president of District 1199, Rob Burrill. And we're here on what we see as just really an urgent matter of justice as the state is contemplating its budget. And as we are in the midst of a once in a century global pandemic, which has obviously upended all of our lives and created needs in terms of folks who are incredibly vulnerable, that none of us, I think, on this call, none of us that are living today has ever seen. Our state public sector members in 1199 work in Department of Children and Families, where they care for kids that have been through absolutely horrific situations. Folks in the DDS, who are long-term care recipients with developmental disabilities. Within the Department of Corrections, our inmates within the penal system, and folks with mental health and substance abuse issues in DEMAS, along with a number of other agencies. The past calendar year, I think that we all can say, particularly for working class people, has absolutely been horrific. The scale of suffering that people are dealing with right now is really difficult to capture. When you think about 1 in 5 Connecticut residents being at risk of hunger, including 1 in 4 children, unemployment that over the summer was in double digits, 7,600 Connecticut residents, last time I checked, that's actually a couple weeks back, who've lost their lives due to COVID-19. Which has absolutely disproportionately hit essential workers, working class people, the elderly, folks who are incredibly vulnerable, and particularly our essential workers as Black, brown, and working class white folks who really have been the only people that have been asked to sacrifice during the course of the pandemic. It's been a tremendous amount of suffering and tragedy. We see the service proposals which we are discussing, and which the two commercials that we're going to be highlighting today profile as being urgent matters of racial and economic justice. Connecticut's challenges in terms of providing social safety net supports for folks are not new. We are now 13 years into austerity since the onset of the Great Recession in 2008, where there has been cut after cut to social safety net provisions that have been devastating for the service recipients, and obviously have had a also painful impact on the 1199 public sector members who do God's work. Okay, these are not workers who are motivated by becoming extremely wealthy. They're motivated by giving back to their communities, by the love of healing folks, by a calling to protect and to care for those who cannot protect and care for themselves. And they've seen wave after wave of cuts to their own wages, benefits, and staffing, which is making it increasingly difficult for them to provide for the care for their clients. Nothing compares to what the past calendar year has been, though, in that regard. When I talk about racial and economic justice as inseparable from this call to improve services, what am I talking about? Conditions such as the following. In the city of Hartford, a 300% increase in calls to the mobile crisis hotline. What that hotline does is it dispatches clinical teams directly to people's homes when they are having mental health emergencies. If somebody's having a psychotic break, if they're having a suicidal episode, those teams will leave in the middle of the night to largest city in the state, Bridgeport, actually does not have 24/7, 365 mobile crisis coverage. And so we are talking about a lack of services that directly impacts the ability of people to live and to breathe. And this in Hartford, 200-person waiting list for addiction services. Statewide, we believe that just among 1199 members, there are 1,200 open positions. There are waiting lists. There are unmet demands for services. And so now of all times, we should be expanding services to save lives and to improve the conditions in our communities. In addition to expanding mobile crisis so that it's 24/7, 365 from one end of the state to the other, we are also calling for expansions in housing supports for folks with mental health and addiction issues, for respite care for families who have children in DDS care within the state, and for reentry programs so that as we move towards being a second chance society, there is an ability for folks exiting our prisons to get the help that they need in terms of mental health and substance abuse, so that they can really rebuild their lives and contribute to communities in a positive sense. Another note around racial justice, in the wake of the civil rights movement, public sector employment has been really the key location where Black folks, Latinos, women have been able to make some progress in taking steps towards being in the middle class. So when we talk about ratcheting back services, cutting services, privatization, those are things that have a direct economic impact that is disproportionate on the small number of Black and Latino workers and women workers who've been able to reach some level of parity with their white and male counterparts. And to be dealing with a report like the one that came out yesterday from the Boston Consulting Group, which took $2.2 million of taxpayer money in the state of Connecticut to announce that they're looking to privatize services in the Department of Corrections, in DCF, in DEMIS, in DDS, and track those workforces into permanent poverty wage jobs that pay people in the private sector in DDS $14.75 is really appalling at this time of incredible need, particularly when, for once, Connecticut cannot talk about being broke. There's a $300 million surplus from last year's budget. There are $3.5 billion in the rainy day funds. The state's 17 billionaires are collectively $4 billion wealthier than they were on March 1st of 2020. And there's almost $3 billion of federal money coming to Connecticut from the stimulus plan that President Biden just passed. Both that stimulus and the December stimulus have significant funding for mental health that has not been implemented into this year's budget to expand the vital services that we're talking about. This week, we are sending letters to the commissioners in Department of Correction, in DCF and DEMIS, that is asking that those commissioners direct some of that federal money towards these vital programs that 1199 members and the wonderful allies that we have on this call today are asking to see expanded. And so both today's press conference and the kickoff of the ad campaign that we're talking about are our efforts to make sure that we heal the people who have hurt so much over our state, certainly for the last 15 years, but never in any time greater than in the past calendar year. We hope that our elected officials in the executive and in the legislative branches can hear our plea, because currently the suffering of working class people, Black folks, brown folks, working class white folks, the disabled, the mentally ill, the substance addicted, the suffering is invisible in this budget. Any attempt to address that suffering is invisible in this budget. And we can do better as a state. Our elected officials can do better as people who were put in office to improve the quality of life of all people in Connecticut. I'll stop there, and I want to again thank our guests and our allies in joining us in the call. We're going to start with Jamim Davis, who is a leader of Bridgeport Generation Now. Thank you, Jamim.
Thank you, everyone, and thank you, Rob, for laying it out so clearly for all of us on the call. I am the co-director of Bridgeport Generation Now, along with Callie Heilman, who is also on the call. And I want to begin my comments by pointing out that during the pandemic, there was a crisis that ensued where a Black man, 46 years old, was killed by police officers, was murdered. That man's name was George Floyd. And you know, what happened to him really sparked a movement in this country like we have never seen before since the civil rights movement. So I'm going to begin there and say, you know, Black Lives Matter is a call for the liberation of Black folks, for the removal of structural, institutional, and economic violence that has thwarted progress for Black people and the progress of the nation. We at Bridgeport Generation Now are committed to that liberation, as we know everyone who marched, protested, rallied, and staked signs on their lawns remains committed to. The people expect that our commitment will be met with real structural change. We see the Recovery for All progressive tax proposals currently in the state legislature as one tool to make social and economic equity a reality. Of particular importance in Bridgeport is funding for 24/7 mobile crisis units and teams that Rob just talked about, so that people can get the services that they need when they're having a mental health emergency, instead of having to deal with the police department and the criminal justice system. That is why we are here. That is why it is critically important that this budget expand services for real people who have been suffering for years and years and years in the United States of America, and in particular in Connecticut. Thank you.
Jamim, thank you so much. We're actually now going to go to the video just to share some of the message that we hope that our political leadership hears.
Okay, screening video.
Pedro, the audio doesn't seem to be working.
What's that?
I don't think the audio came through.
The audio's not coming through? Oh boy. All right. Try it again. Okay, here we go again.
No matter where you are,
I need help.
no matter what time it is,
Hold on, son.
you should not be alone. You should be able to count on our services.
I'm just so sad.
Please, come here
No
quickly.
entiendo por qué no contestan.
He's having a panic attack.
If I could just talk to
Please
someone.
pick up the phone.
I'm afraid. Something's wrong. I don't feel right.
Connecticut Mobile Crisis Unit. We're on the way.
Expand mobile crisis to save lives. Call your legislators now.
We're going to go next to somebody who knows firsthand the difference that state services can make in the lives of families and care recipients who need mental health supports. Kate Atkinson is the mother of a patient at the Western Connecticut Mental Health Network, which is a state-operated mental health clinic in Waterbury.
Yes, thank you. My husband and I have a son who developed psychiatric symptoms late in his teens. He actually was at 18 that he had his first psychotic break. He went through the revolving door of psych hospitalizations until age 24 because bipolar 1 and psychotic seizures. And this was very difficult for us to deal with. Basically, every time we got out.
Kate, I'm sorry to interrupt, Kate. Your
Yeah.
audio is coming through. Now it's better. When you got closer, the
Oh,
audio
okay.
was better.
Thank you.
Oh, there it is. Yeah, please
Okay.
start over. Thank you.
Okay, our son has bipolar disorder, and this did not really become apparent to us until after high school, when he was over the age of 18. So we had great difficulty in getting him services. It was only by 911 calls and an ambulance to the hospital. And we basically went through this revolving door for 6 years, from 18 to 24. And through that time, it was very traumatic, not only for him, but for us. It was way beyond our ability to take care of his needs. And after much trauma, he finally received state housing at age 24. That helped a lot. They monitored his meds. He had case management on site. And he actually was able to work part-time. That was his most stable period from 18. But when he reached the age of 26, they moved him out into the community. He had to get his own apartment. And I think legislators don't always realize, they hear the age of 26 and they think of an average person, but developmentally, he was way behind. And I knew it was a mistake, but he was beyond our ability to manage. He couldn't live at home. So he got his own apartment. And during this whole time, I was so upset about the difficulty of navigating both the addiction and mental health system and all the shortfall. Many times he was brought to an ER and not even brought up to the psych floor. He would be given a shot of Xanax, didn't want to go, and they let him go, even though he was manic and psychotic. He could present and make a case to get out. So this is what we went through for those 6 years, and I felt like I was his untrained case manager. So I went back to school to Naugatuck Valley and ended up working in the field. But even that, I couldn't change his destiny. He kept falling through the cracks because he didn't have the insight to seek all the services needed. Once he got out of Hope House, where, that was his most stable period, those 2 years, the past 4 years, he's age 30 now, he has done very, very poorly. He's had to have teeth pulled due to not going to dental appointments. He has much of the time been in a low level of delusional depression, but not bad enough that a hospital will hospitalize him and put him on meds. Just enough so he can get by in his own apartment, doing nothing, paranoid, seeing his case manager, who is highly skilled, a couple times a month, but that just doesn't meet his needs. And I'm constantly trying to intervene, get more help for him. But it's, the laws don't allow for that. He's had 3 severe bouts of mania during that 4 years, one of which he was badly injured. I had called 911, and again, he didn't meet the criteria to bring him in. Even though he was psychotic, he said, "I don't want to go." That night, he thought that there was a bomb in somebody's car, and told the person to leave. They were parked in front of his apartment. And the person beat him up and broke his nose and left him on the hood of his car. And these are things that really upset me when I see he's psychotic and it still takes 2 or 3 phone calls or 2 or 3 ER visits before someone is brought up to psychiatric care. His most recent hospitalization in January, he was brought in at 103 pounds. He is 6 feet tall, had been eating very poorly the past year due to his paranoia. He also had to be in a wheelchair for 10 days, even though he's a 30-year-old male. He should be in his prime. Because of his paranoid state for the last couple months, he had taken off his clothes. He was very fearful about corona. And for someone like this, even though his case manager at Western is highly skilled, I admire him very much, he's overburdened. As all of you said, with corona and everybody's needs and the isolation, he just kind of pulled up. And I would try to bring him out to lunch. He didn't want to get out of the car. I'd have to get food and get to him. Ensure, but even so, the system is not meeting his needs. The young adults has a great budget, but once you become 26, even if you haven't improved, you're on your own. It's all self-initiated care. And for many people like my son, they just fall through the cracks. So I really think there needs to be a lot more monitored, supervised housing for somebody like my son, who is not mentally retarded. He has many abilities, but he just can't pull it together. He gets symptomatic, and then there's like no safety net.
Kate,
until
Kate, I think we need to move
Yes.
on to the next speaker,
Okay.
but I just,
Yes.
but I want to thank you so much
So
for having the courage.
More adult housing, that's what I'm asking.
Thank you. And thank you so much for having the courage to share your son's story. I think that, especially within the last year, I mean, I know personally, I'll bet all of us, it's hard to count the number of people who I know who have had some form of mental health crisis in the past calendar year. In some cases, extremely serious issues. So thank you for sharing that. We're going to move next to Willow Wensley. I apologize, Willow, who is a patient at Western Connecticut Mental Health Network. Willow, can you unmute your there you go.
Yes. I'm Willow Deely. Hi. I live in the northwest corner of the state. I contribute to my community by volunteering because my chronic mental illness makes it impossible for me to be employed. I'm legally disabled by PTSD. It's important to me to get the word out as to how things really are for people suffering from chronic mental illness and behavioral illnesses. The pandemic and its isolation has put a lot of stress into my life and into the lives of others. I've needed more support from my mental health services, even though that support has to happen remotely. Here are some examples from my life. 1, my residential counselor helps me get through my bills and make important phone calls. Without this help, my light and heat would be shut off and I would have a crisis. 2, Western Connecticut Mental Health Network in Torrington helps me get through painful times. Normally, they hold classes there in how to stay well. And they're now looking toward resuming these classes, but it's a long process. But they don't have enough teachers. They need more teachers. 3, I've been an active member of Primetime House for 32 years. It gives me a place to contribute to a community that accepts me. They too are understaffed and underfunded. 4, I personally know 2 families who have broken up because of poor services from DCF. These families need support in order to stay together. The children need to stay with their parents in their own home, supported. 5, I do need the crisis hotline. And crises are worse in the wee hours of the morning. It's dark, everything's scary. You reach out, nobody's there. The hotline is very important to save lives. Finally, I am currently in so much anguish that I really should go to the hospital. But I don't go because there's no one in the crisis center of the ER who will talk with me or listen to me. They just leave you alone there for days in the fishbowl until a space opens up in the psych ward. It's torture. It's torture to go there. That's why I don't go. I see that people like me need increased support just to stay out of the ER, the hospital, prison. Preventing crises actually saves money. An ounce of prevention is worth a pound of cure. Mental health services are needed now more than ever. Lives are being impacted. I can tell you that. I can tell you that. So I hope that our words are heard.
Willow,
Thank you.
and thank you so much. I'm glad that you are able to get some of the support that you need from folks over at Western. And again, I just think that it takes tremendous courage to be vocal about a problem that is so often unseen and unheard, and that we just need to make a lot of progress in being able to talk about openly. Thank you. Next, we're going to James Bendary-Alexander, who is at the Yale Transitions Clinic. James, go ahead.
Hi, good morning, everyone. I'm James Bendary-Alexander. I am the legal director of the Transitions Clinic. We have 4 locations across the state where we serve people coming just out of incarceration, serve their healthcare needs. And the basis of our model is that we have doctors and social workers working with formerly incarcerated community health workers to make sure people are making appointments, making real connections in the community, getting their prescriptions filled, et cetera. The problem that people coming out of incarceration have right now, I mean, there are many problems, but one of the ones that's very fixable is the fragmentation of the system and the lack of investment in reentry. We think that as part of the Recovery for All proposal, we're excited about the idea of justice reinvestment, which is taking some of the money that we've saved from closing Northern Correctional and some of the money that we can raise through new revenue to actually provide coordinated reentry services, not just through the Department of Corrections, but out in the community, so that people have a place to access housing, people have a way to access healthcare, people have a way to connect with community organizations that is actually organized and available. As it stands right now, we have far too few reentry coordinators in the Department of Corrections to actually help the people who are leaving every month. We have far too few places for people to access healthcare. We have far too few places for people to have safe housing. And the Recovery for All Coalition has put forth an agenda on reentry that would unify these services, fund these services so that every single person can safely decarcerate. At Transitions, we want less people in jail. We want no people in jail, to be perfectly honest. And we want a safe decarceration. And safe decarceration means coordinated services. It means investing in healthcare workers. We think the Transitions model is a great model because it not only addresses the healthcare needs, and it does that extremely effectively. People coming out of incarceration in the first 2 weeks are 12 times more likely to die than a person in the general population. We can fix that, but what we also do is that we have a model that incorporates that training and hiring of formerly incarcerated people as community health workers, which is the first step in a healthcare career. Recovery for All Coalition has invested in that idea, has put that idea forward, and what we need are the funds. As has been mentioned, we have a large amount of funds coming to the federal government. We have a large amount of funds in the rainy day fund. We have unprecedented need. And so I am excited to be here. I think the Recovery for All concept is the solution to the problem in the reentry world. Lack of services, too much fragmentation. I think then if we invest in people, in these services, in the health, in the housing, you're going to see healthier communities overall coming out of this pandemic. Thanks.
James, and thank you for the amazing work that you and others at the Transition Clinic do in helping folks who have made mistakes, but mistakes that they've served their time for being able to have opportunities to contribute to society when they come back to their communities. We obviously know how much Black and Latino communities in particular have been devastated by the war on drugs, you really give people hope in the work that you do. Thank you. We're turning next to Reverend Josh Pollack, who's from the Unitarian Universalist Society East.
Hi, Rob. Thank you. Thank you, everyone, for being here. My name is Josh Pollack. As Rob said, I'm the minister of the Unitarian Universalist Society East in Manchester. I'm also a clergy leader with the Recovery for All campaign. The underlying message we are hearing today, and the underlying message we've been hearing throughout the coronavirus pandemic, and throughout the racism pandemic, and throughout the current legislative session, the underlying message we are hearing is that the economic need is immense in our state. The housing needs are immense in our state. The healthcare needs are immense in our state. The race and class-based disparities are immense in our state. Stress, trauma, and crisis are immense in our state. And the resulting need for services is immense. Recovery for All campaign and bargaining for the common good proposals respond directly to this need. The Recovery for All campaign recognizes that one of the reasons the state historically resists responding positively to proposals like the ones we're hearing today is that they are expensive. The state will almost instinctively say the money isn't there. At Recovery for All, we say the money isn't there because our tax code is unfair. One of the greatest generators of need is the tax code. If you earn an average yearly income in Connecticut, that's in the vicinity of $40,000 a year, you pay 2 to 3 times more in taxes as a percentage of income than people making $600,000 a year or higher. That's it right there. That is a structural recipe for stark income inequality. And that is now why the need is so immense. But we know there is enormous wealth in Connecticut, and that wealth can be used to invest in our people, in their healthcare, their housing, their jobs, their mental health services, addiction resources, respite services, home care services, mobile health units, and on and on. But none of that investment can happen as long as the state's enormous wealth flows to a relatively small group of billionaires and millionaires. Why are we so afraid that these people will leave the state if we raise their taxes? Why are we afraid when the best academic research shows that the reasons why people move have little to do or nothing to do with tax policy. We have to overcome this fear. We have to be bold. I hate to say it, but our governor is not being bold, and I'm concerned that our legislature is not being bold. I'm concerned that they're being timid at a moment when we need them to be bold. Let's stop tolerating immense inequality. Let's stop tolerating austerity policies and disinvestment. Let's respond to the real need so many Connecticut residents have. And dare I say it, let's show our Connecticut spirit. The Recovery for All campaign is fighting to change the tax code so that we can invest in the common good. Those investments are what our proposals are all about. Thank you.
Reverend Josh, thank you for speaking with such powerful moral clarity about the human needs that should be apparent in our budget, but are currently missing. Next, we're going to go to our last speaker, who is somebody who gets up every day and really does God's work in healing folks, Sandra Morton, who is a licensed clinical social worker at Capital Region Mental Health Center.
Good morning. My name is Sandra Morton, and I'm a licensed clinical social worker in the Department of Mental Health and Addiction Services. I work in mobile crisis as a trained clinician at Capital Region Mental Health Center here in Hartford, where we help people who are experiencing mental health emergencies. Mobile crisis services are a collaborative intervention providing the most effective strategy for responding to mental health emergencies, preventing suicides and overdose deaths, and reducing ER visits. We are the workers who provide the safety net for the most disadvantaged people with severe and prolonged mental illness, often complicated by substance abuse in Hartford and across Connecticut. We disproportionately serve people of color. Over many years, and especially in the last 10, however, chronic underfunding has cut our services to the bone, leaving huge gaps in coverage on nights and weekends. As a result, mental health emergencies are often handled by the police, not trained mental health professionals like us. We need to expand mobile crisis services now more than ever. The pandemic and the huge mental health crisis that it has created have exposed the cracks in our safety net. Cracks that our members and our clients have known about for a long time. At Capital Region, the number of calls we receive from the police has tripled since the start of the pandemic. This is why we, the members of 1199, are standing united with community organizations. Together, we are saying loud and clear, this state can and must do better. We have the resources to fund universal comprehensive mobile crisis services statewide. We are demanding this as a matter of justice for the people that have been left behind in our society. We are demanding this as a matter of racial justice because the majority of the individuals we serve in mobile crisis are Black and brown. It's not a coincidence that these cuts have been made to a service that primarily assists working class communities and communities of color in particular. This problem is systemic. One Saturday, while my coworker was working, she responded to a 211 call from a woman experiencing an emergency. She had overdosed. My coworker knew the woman and her specific needs, so she was able to react quickly. If the woman had called later on during the night and got the answering machine, she would have died. It was only because my experienced coworker was on shift to take the call that a precious life was saved and not lost. We refuse to let the state slash the services that people need. This year, we must expand mobile crisis services. Is the difference between life and death. Thank you.
Sandra, that was just so powerful. I just thank you for stating it so clearly and for the work that you get up and that you do every single day. In closing, I would just say that we've heard a lot of lip service about compassion and equity and racial justice over the past year. Justice demands equity, but equity demands dollars. Okay, equity demands resources. And so budgets, as we know, are moral documents that speak to what our values are. When we look at this budget, I think we can just ask ourselves simple questions. Who is privileged? Okay, and who is invisible? The most privileged people in our state are further privileged by this budget in its current state, which protects them from having to support those of us who have been suffering, the essential workers and the people that essential workers care for during the past year have been the only people that have been asked to sacrifice, while the millionaires and the billionaires have been becoming wealthier at a record pace. And so we are calling upon our elected leadership to do the courageous work of justice, to do not the easy thing, to do the hard thing, okay, but to do the right thing in directing dollars in places that expand services and save lives. And if we think about what was asked of essential workers in the past year, frankly, that's a lot more courageous than anything that is being asked of our elected leadership in doing the right thing and in meeting service needs that will help to reduce suffering. If there are any questions from members of the media, we're happy to take them. All right, if there are no questions, I just want to thank everybody who called in today and participated. Willow, Kate, James, Jameem, Reverend Josh, Sanja, and all others. Thank you so much for your tireless work in helping to try and move our state towards a vision of justice. Together we can win. Thank you.